Disproportionality is by definition the over-representation of children of one race in the foster care system when you compare to the percentage of that race in the overall population. 14% of the population of the United States is African American children, but in the foster care system there are 24% of the kids in foster care that are African American. So that means that African American children, black children, are disproportionately overrepresented in the foster care system. Similarly, white children make up 50% of children in the United States, and only about 40% of those children in foster care are actually white children. And so white children are underrepresented in care. And what we find is that across the board, in general, children who are black or brown are overrepresented in the foster care system as compared to their white peers. There's also a term that we call disparity, and disparity in foster care means that there's unequal outcomes for children who exit the foster care system or enter the foster care system and remain in foster care based at least as identified by their race. So there are some factors there that are really difficult as well. For example, black children remain in the foster care system longer than their white peers. And white children are 4 times more likely to be able to be reunified with their birth parents than black children that come into the foster care system. So in general, in this country, we have a very significant racial problem in the child welfare system. There is a correlation in terms of poverty and child welfare involvement. And we know that poverty is a generational impact that racism has created for families of color in the United States. And so most definitely, people who are poorer have a harder time accessing the resources that they need to be able to adequately care for their children. For example, things like child care and access to health care or mental health care, transportation, all kinds of factors that can lead to issues that are seen as neglect potentially, or can contribute to family stress, increase the likelihood of child maltreatment. And so because more black families live in poverty, more black children are likely to be reported for potential child abuse or neglect. That's something that we as a society all need to be focusing on and doing something about. But other things are there too. There's visibility or exposure bias. There is limited access to services, which I kind of touched on with the poverty. Geographic restrictions. Some areas are much poorer in resources than others, and if you don't have, again, adequate access to transportation, oftentimes there are services that are beyond your reach. And then there's always the issues of bias in general. And history plays into bias as well as people's individual biases in the child welfare system. So for example, if you are a black family and you're struggling with factors that you need potentially outside assistance with, it's highly probable that you may not be as trusting to come forward to nonprofit or government agencies to ask for help, because historically those situations have not been good. So black families oftentimes have, or families of color have elected to remain under the radar rather than bringing themselves to the forefront. And that is a factor that I think sometimes contributes to over-reporting too, is that if you're in poverty and if you're needing to access systems that provide you with financial benefits or health care coverage for your kids, you're more likely to have to appear in front of social workers and folks whose own personal biases may potentially contribute to over-reporting of potential child maltreatment. So then that factor is the last factor, which is individuals, either explicit or implicit personal biases that definitely can contribute to what they perceive as risk for kids and then what they report to the child welfare hotlines. So as we're looking at racial justice in general, as an organization that really is a social justice focused organization, We look at this issue from a multiple lens perspective. So first of all, we believe children should be with their families whenever that's at all possible. And so we work initially on prevention of children coming into care. We have a program called Fostering Prevention where we work with families at risk, and our effort is to improve whatever those circumstances are so that those children don't end up having to come into care and are able to remain safely with their own families. Additionally, our recruitment programs, both our 30 Days to Family and Extreme Family Finding, are focused on finding members of that child's own extended family or kinship network with whom they can stay while they need to be in the foster care system so that their parents can work on the issues that brought them into care. Those are all things that hopefully help keep kids connected to their own families and their own racial and ethnic and cultural backgrounds, even if they have to be involved in the system. But the issue of overrepresentation in care is one that we're still trying to figure out how to tackle effectively. So we're looking forward to a partnership that we're starting hopefully sometime this spring, where we're going to bring in some national consultants to really evaluate the data around overrepresentation of kids in care in the Kansas City metro area on both the Missouri and Kansas sides. And then convening a group of community leaders to try to come up with a strategic plan for the Metro KC area to try to address that overrepresentation with solutions that reduce that disproportionality.